first chart. Well, thank you for other doctors from all over the world. Do you hear me clearly? Yes. Okay, well, I am Dr. Uram Kim, a plastic surgeon. Thank you for coming here. I'm only too glad to meet you. So as we know, we are all in trouble. Fortunately, the situation is calming down in some places, but still, we cannot meet directly and cannot share information hand to hand. That's why they prepare this web seminar. So, well, because it's the first time, there will be a lot of mistakes or uncomfortability. Please understand this. The web conference will be held 4 times on every Wednesday, 5 p.m. based on Korean time. Well, I introduce some topics, 1 or 2 topics a day, and I also perform a procedure. This is the process of accumulating the experience. As I mentioned, there are some mistakes. Please understand it. Well, I've been doing throttle lifting for more than 10 years, but still there are a lot of new products, and the applications are endless. I know that my procedure is not perfect, and I also know that there are a lot of good doctors who can perform more effective and more sophisticated procedure than I can do. So, if my procedure were the guide for the beginner, or it can be a comparing reference for the experienced doctor to improve their techniques, it would be a great honor to me. Well, and I'd like to apologize first that I cannot speak English so fluently. I will try to speak very slowly. Well, let's get started. 파워포인트 주세요. 시작해도 됩니까? 네. 네. Today we're going to talk about the cog master gear. 안 됩니다. Next. So properly speaking, the history of the throttle lifting. Originally, the throttle lifting is invented by a Russian Dr. Shulamanich. He cut the polypropylene thread partially to create cutting cork. It is a very interesting idea, but it has some limitation. And there is another invention from Korean acupuncturists. They invented mono thread. Actually, the cutting cork is the result of the combine these two ideas. So, the thick cutting cork is loaded on a cannula or a needle. So it's very useful to correct the drooping appearance of patient, but there's a lot of limitation because the thread is very weak. It can be easily broken, and there's some weakened part on the thread. It can be easily cut. So they finally invented another types of thread, which is also called skirted cork. So to make skirted cork, from one whole thick thread, they skirt off useless part. Finally, it can create intact main stem with protruding big cogs. So this cog is very strong. Next. Next. So the cog cannot be easily injured, and there is no weakened point on main stem. It will not cut as well. So actually, we have some model of cutting cog Pro, and dual lifting 2 is made from cutting cork, but it's not so effective as we know. So this is the schematic picture of cork master gear. Bidirectional sculpted cork is loaded on a L-type cannula. Please check the tip of the cannula. It's not complete one, it's half one. So when you insert this cannula into the tissue, you can feel less resistance. So I've used cork for a lot, but nowadays, next, I prefer to use cork master gear. Next. So I'd like to introduce more advanced type of thread. It's called negative cork. Different from the protruding sculpted cork, the cork is the cork on the cork is depressed. They punched out the cork portion, so it's much thicker than the sculpted cork. Usually the USP number 3 or number 2, but there's no protruding part on the main stem. This thread can be loaded on 18 gauge needle or 19 gauge needle. So let's summarize the model of cork master gear. The cork master gear 1 is the full arrow-shaped sculpted cork. Cork master gear 2 is half-shaped arrow sculpted cork. The cork master gear 3 is negative cork. So actually the negative cork is the strongest one. So it's very strong. So once you misapplicate, it's very difficult to correct. So if you are a beginner, I recommend to start with cutting cork or sculpted cork. After accumulating some experiences, you can try the thicker one like negative cork. And there are another model. The white one is PLA shell cork master gear 1. The materials different from PDO. It goes further about 2 or 3 times. I will talk about this material next week. Then let's talk about the application. This is lifting procedure. Usually we can apply the thread from the upper lateral portion to lower medial portion. So once I can puncture the skin on anterior hairline of the side bone and posterior hairline and the point under the ear. Into one skin hole, I can insert 2 cork master gear thread. So you can just insert, the inserting is enough, but if you want to get more secure anchoring, you can tie them together. Don't forget to vary the knot. You know, tie method itself is very complicated one. I'm already accustomed to make a hand tie, but if you're a beginner, you can use needle holder or mosquitoes to make a knot. But as I mentioned, it's quite complicated. For the beginner, I recommend this simple method. First of all, I can make a line from the lateral end of the eyebrow to the tragus. Then you can make 4 points on it. On each point, you can insert 2 threads, downward medial, upward lateral. So you can pull the tissue, you can get the tissue upward. If the correction is not sufficient, you can also insert some more thread from the anterior point of tragus to the lateral side of the jowl. So well, I've been presented in many countries, so I could find that there is a big racial difference. For example, in Korea, the Far East Asian has really thick skin and their soft tissue is very heavy, so it's very difficult to correct them with thread. And usually we have very flat face. They want to make their anterior side protruded. So I can also apply some thread from the most protruding part of the jaw to medial canthus, lower lid, and lateral canthus. It can augment the anterior molar, and the people in Korea believe that it's the appearance of the use. How to apply this Kagmaster gear thread is also very easy. Because it's loaded on a cannula, you should, 또 다시 한번 클릭해주세요. You should puncture the skin with 18 gauge needle. Then you can insert the cannula into the skin very slowly. But when you feel some resistance, you should go back. But in this time, you should grip the cannula and thread together. If you only grip the cannula, the thread will remain into the tissue, so it can make a big mess. And when the cannula end reaches the targeted area, you can twist the cannula 1 or 2 rounds. It can secure the fixation of the thread end. Then remove the cannula slowly. Pull the thread a little bit more. You can cut off the exposed part. There will be some dimpling on inserting point. Mild rubbing can disappear this. I'd like to inform one more model called dual lifting. It's long bidirectional skirted cork, but both ends of the thread, 10 cm long, blunt needles are connected. So if we use sharp needle, it's easy to insert, but it can create some collateral damage, which can make bleeding, swelling. Sometimes it can create nerve injury. So the blunt needle is much safer. We can apply this thread in U-shape method or V-shape method. If you make 2 anchoring points, it can be a U-shape. It can give you very secure anchoring, but there can be some irregularity between 2 points. So if you apply the thread on exposed part, I recommend the V-shape, which has less scar. And don't forget, if you use dual lifting thread, you should insert 2 needles into exact the same skin hole. If there is some difference of inserting point, the loop of the thread will bite the dermis, so it can create terrible dimpling like the picture. So it's very difficult to correct. Of course, we can use dental hook to correct it, but the prevention is the best. Exposed area like anterior point of tragus or side bone, I prefer to apply in V-shape application because it makes less irregularity. But if I need somewhere which requires better anchoring power, U-shape application or W-shape application is better. I can also correct the drooping appearance of a medial neck with a dual lifting thread. I applied Kagmaster gear and dual lifting thread to correct this patient. Well, actually, the size of face is quite different. Usually, Korean has bigger face than Arabic or European, so it's not simple to correct them. But by the help of this strong thread, I can satisfy the patient easily. I'd like to inform one more information. So, well, there are a lot of facial expression muscle on the medial side of face. So if you insert thick thread here, the patient will complain some foreign body sensation when they make facial expression. So the thinner thread is better for the medial part. But you can insert a thicker thread on the lateral side. Well, actually, this is the end of my presentation today. I should prepare today's procedure, so it takes a couple of minutes. So during that time, they will show you the new product of Alfa Medical. Thank you. Thank you for listening.
Again, I'm Dr. Uram Kim. Thank you for observing my procedure previously. Well, because I've already presented this lecture, but you didn't share it. So some of you couldn't see this. I will do the lecture again. 자, 파워포인트 좀 열어주세요. So I would like to briefly introduce the cog of cog-master gear and dual lifting thread. So I want to talk about the cog-master gear. Some of you already listened to this lecture. So briefly, speaking, the history of thread lifting. Originally, it's invented by a Russian doctor who cut the polypropylene thread partially to create cutting cork. And there was another invention from Korea. A acupuncturist invented mono thread. The cutting cork thread is the result of combining these two ideas. We cut the PDO thread partially to create the cutting cork, and we load it on the cannula or long needle. But as we know, it's used prevalently, but the effect is quite limited because the cork can be easily broken, and there is some weakened portion on the main stem, so thread can be cut on that point. So they invented a stronger thread called the sculpted cork. 자, 다음 슬라이드 좀 눌러주실래요? So to create the sculpted cork, it starts from one big whole thread, scraped off useless part to create uninjured main stem with protruding big strong cork. Because this cork is strong and big enough, it cannot be easily broken like the cutting cork, and there is no weakened point on the main stem. It will not be easily cut, so you can tie them together. From the aqualift, we have the model of cutting cork. They are cork flow and dual lifting thread 2. So they have spirally located cutting cork through the thread. I've used it a lot, but it's not so effective now. So I moved to the next step, the sculpted cork. This is the schematic picture, the schematic photo of the cog-master gear 1 thread. There are bidirectional sculpted cork is loaded on a half cannula. Please check the tip of the cannula. It's like an L shape because it has less resistance when you insert into the tissue. So there is less locking between the cannula and the thread. So I've used cutting cork a lot, but nowadays I prefer cog-master gear thread. I'd like to introduce more advanced type of cog-master gear. It's made from negative cork, different from the previous sculpted cork. On negative cork, it's the first type of cork. So the thickness of this thread is much bigger than that of sculpted cork, about number 3 or number 2, about 2 or 3 times bigger than that of 1O or 2O. It has the strongest anchoring power. Once it gets the tissue, it will never release it. So you should be very careful when you apply this thread. Do not overcorrect with these threads. If you are beginners, please accumulate experience with other thread like cutting cork or sculpted cork before using this. It's very effective, but it's too strong to correct this application. So I'd like to summarize the model of Cogmaster gear. The Cogmaster gear 1 is the full arrow-shaped sculpted cork. The Cogmaster gear 2 is a half-shaped arrow-shaped sculpted cork. The Cogmaster gear 3 is negative cork. Actually, the Cogmaster gear 3 is the strongest. We have another model of Cogmaster gear 1, but it's made from not the PBO, but the PLACR, which is transparent. We can check that, that picture on the slide. The PLACR goes further 2 or 3 times longer than that of PDO. So I will talk about these materials next week. So the application, there are a lot of applications because the purpose of this procedure is to correct the drooping. We can usually apply the thread from lateral upper part to medial lower part. I usually make one skin hole on the hairline of anterior side bone, and I can also make another skin hole on the anterior point of tragus. We can also make the other hole on the point around the mandible angle. You can insert 2 threads through the subcutaneous layer downward. Just inserting the thread is okay to correct the drooping, but if you want to get more anchoring power, you can tie them together. But the tie procedure is very complicated. I can perform it with my hand, but sometimes it's very difficult. In that case, you can use needle holder or the mosquitoes. So for the beginners, I'd like to recommend this procedure because you can just insert, that's all. You can make a line from the lateral eyebrow. I already performed this procedure on rib surgery. You can make a line from the lateral eyebrow to tragus. You can insert the pro thread on it and femoral thread upward. To augment anterior malar, you can insert the thread from the most protruding part of the jaw to medial canthus or rib and lateral canthus. It can also improve the nasolabial port. To correct the nasolabial port, as we mentioned before with the doctor from India, so we can also insert the thread from the lateral malar to over the nasolabial port as well. The application is very simple because I've already shown this during the procedure. I will omit it. I can also inform the next model. It's a dual lifting. It's long bidirectional sculpted cork, but on the both end of the thread, the 10 centimeter long blunt needles are connected. So if you use sharp needle, it's very easy to insert, but it can cause some obliteration of surrounding tissue, which can cause swelling, bleeding, nerve injury. So the taper point blunt needle is safer. If you apply this thread on hidden area, you can make 2 holes for the U-shape application. But if you insert this thread on exposed area, the V-shape application is better. So don't forget, you should insert 2 needles into one exactly the same skin hole, or the loop of the thread will bite the dermis, which can cause severe dimpling like the picture. So in this case, you can use dental hook to correct it, but it's not easy. So the prevention is very important. There are a lot of applications to correct the drooping appearance on the lateral face. It can be also corrected the medial neck hooding, like the picture. Well, this is the end of my presentation. Thanks a lot for listening to me today. So Mr. Rothschild will inform next week's web conference.
That was a wonderful demonstration and lecture, Doctor. Let's give him a big hand. All right, so we're sorry about the technical issue. So hopefully everyone has a good listen here. And I know some people couldn't listen or watch the video at the first part. So please join next Wednesday at 4:30 p.m. Well, actually like 30 minutes before your time start. Then we will broadcast the record time, the record version of today's webinar. So we're sorry about that again. So next Wednesday, same time, Dr. Uram Kim will lively demonstrate nose tip lifting and aqualift BC 1 and 2 and eye cannula. All right, so we will see you next webinar on next Wednesday with the new aqualift. I'm Andrea Rothschild. Thank you for watching.